I'm Molly, and this is Care Experts, brought to you by CareCredit and Pets Best. Together, the CareCredit credit card and Pets Best pet health insurance provide all the financial tools that can help you be the best pet parent you can be. Today, we are in Oakland, California with Dr. Andrew Moffatt. Dr. Moffatt is from Melbourne, Australia, and is the founder and CEO of VetnCare, a growing group of AAHA-accredited veterinary hospitals in the San Francisco Bay Area. Today we are here with Dr. Moffatt talking about skin issues with dogs. Thank you so much for being here.
Oh, my pleasure.
So can you tell us, what are some of the most common skin conditions or skin issues in dogs?
Well, we get lots of visits for skin issues, particularly in the spring, the summer and the fall. Maybe half our visits have something to do with the skin. And number of conditions we see in dogs and cats. At a base level, and one of the most common presentations is just a concept around fleas. There's a lot of fleas in our environment up here in Northern California. A lot of the products that we historically use aren't working to the same level. And I think it's also, there's a compliance issue. People aren't always good about putting a flea product on their pet every month. So certainly in cats, the predominant presentation for skin issues is linked to fleas and flea allergy. Certainly that's a component of dog skin issues as well. So that's something we see. We also will commonly see in dogs airborne allergies, and that's probably the most common presentation, assuming that we've ruled fleas out of the equation.
So what should a pet owner look for? What are the signs of skin conditions in your dog?
Yeah, so there's a number of things you should be looking for. Firstly, is your pet in duress? Is it scratching? Is it itching? Does it appear to be anxious because of what's going on? Is it losing hair? Is there a change to the coat? Are you seeing more dandruff? Is the skin and coat looking oily? Is there redness, inflammation? Are you seeing pimples, spots? Are you seeing fleas? Are you getting bitten by fleas?
Is there a way to know the difference, whether it's fleas, allergies, a skin condition? How do we know the difference?
That's why I've got a job. If it was that easy, you wouldn't need people like us. But I think at a base level, if you're seeing fleas and you're familiar with identifying that parasite, then that's a pretty easy one. And certainly if your pet is not on a flea product in an area like this where there's heaps of fleas, that's the first and easiest thing you could do. And certainly working with your veterinarian to find an appropriate flea product for your pet is the way to go. Even I can see a skin condition. I might have some ideas, but I can't tell you instantaneously what it is unless I've checked it out and perhaps taken some samples.
Once that treatment time hits, what does that look like? Is it bathing, medication, supplements? How do we fix these skin conditions?
It can be all of the above, and it sort of depends on the condition at hand. So we see certain conditions where bathing might be appropriate, using medicated baths or shampoos or mousses or wipes might be appropriate. Occasionally we might need systemic treatments like antibiotics or injectable anti-itch medications, antihistamines, things like that. So it's variable and depends on the treatment at hand, but all of those things you mentioned may be part of a management strategy for these various conditions.
Now, what about if a dog starts to lose its hair? So you start to see, hair shedding out more than normal or bald spots. What's going on? What's happening there?
Hair loss typically is an indication of disease, and so that might be we see certain bacteria cause hair loss. We see certain fungi or mites cause hair loss. Sometimes their hair loss is actually just caused by the pet scratching themselves. They're so itchy, they scratch, it damages the hair. Looks like they're losing hair, but actually it's just they're self-traumatizing.
So how do I prevent my dog from having that dry, flaky skin? Are there any topical ointments that are good? What are things I can do to help prevent that dry skin? Yeah,
so I'm not a big fan of ointments in dogs because of their coat. They just get really messy.
Right.
So I think if you're seeing dry, flaky skin, to me it's an indicator that we have to rethink our nutritional strategy and maybe get that pet on a better diet where it's more appropriately balanced for fats and oils, or maybe more applicable to its life stage. There are certain diets that are more appropriate for dogs with dry skin, like a dermatology diet, which might be something that the doctor prescribes. Flaky skin can be an indication of disease. So we'll often see flakiness associated with yeast infections or low-grade bacterial infections or low-grade allergies. So is it one of those things causing a problem, or is it like a nutritional deficiency? We have to separate those two things so that we know how to treat it appropriately.
We'll be back with more Care Experts after this brief message from CareCredit.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion with Dr. Moffatt. So for flea medications, we know how important they are. There are so many different kinds, topical, oral. What do you recommend? How do we decide which one is right for our dogs?
It's a good question. So they all play slightly different roles, and like everything, there's different levels of quality. So typically the newer generation products that are most effective in terms of speed of kill and resistance and penetration and safety are available through your veterinarian. Older products that have come off patent are more available in your general retail store. So it's not that those don't work, but if you've really got a problem with fleas, you should be working with your local veterinarian to get a recommendation.
Okay. And what about the dreaded hot spot? Why do our dogs get them? What do we do? What's the best way to treat them?
Hotspots are a real pain and cause the pets a lot of discomfort and the clients a lot of anxiety. They often happen very quickly. Strangely, it always happens on the weekend when no one's available, and what do you do with that? So dogs that get consistent hotspots probably have an underlying allergy or a flea problem. Essentially how a hotspot develops, something traumatizes the skin. That could be a flea bite, it could be a scratch, it could be a tick bite, whatever it might be. And then the pet starts scratching and licking, and that skin gets further damaged. We have to remember that we are covered in millions of bacteria, and those bacteria are our friend if our skin is healthy. But if the skin is damaged, those good bacteria can infect us and become bad bacteria in essence.
What are your opinions on groomers? Should I take my dog to the groomer?
Yeah, good question. So groomers are fantastic professionals that every pet needs to ensure that their coat is well maintained, no dissimilar to us finding a good hairdresser that we trust. So finding a groomer is like finding any professional. Word of mouth is a great place to start.
And does keeping our dog's hair short, does that help skin conditions or skin issues?
I don't think necessarily. It's to do with the breed and what their natural coat is. I see lots of dogs with long coats that have perfectly good skin quality and hair quality. It's well maintained, often with the help of a groomer. Sometimes clients are just really dedicated to skin and hair quality in their own right and can do a lot of work themselves. And then I'll see dogs with really short coats with lots of skin disease. So I think it depends on the breed and the individual.
So tell me, how do I know the difference between a bump, a lump, a tumor? Is it a skin tag? How do I tell the difference?
So it starts by feeling it, using our hands and assessing that area, and then looking at it. Now, if it's under the surface, we might not be able to see it. It might be all on palpation. So I think when you see a mass or a skin tag or a lump, I would use a mass and a lump interchangeably. Cancer, neoplasia, and tumour are all the same thing, and they're often used interchangeably. So when and we have to remember that cancers or tumours or neoplasia is a more scientific term. Clients, when we're talking to clients, we'll often talk about tumour or cancer, same thing. So within that sphere of diseases, there's obviously really malignant, nasty cancers, but there's also lots of benign cancers. In fact, the majority of cancers are probably benign or intermediate and not the really advanced type. So we can only determine that by testing the mass. And so if I find a mass that is significant, that has changed over a short period of time or shows characteristics of being something more significant, we will often test that.
Well, thank you for helping us figure out all things skin issues with our dogs. It's really important to us, so thank you so much.
Oh, my great pleasure. Thanks for having me.
Yeah. Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. And Pets Best offers comprehensive pet insurance plans that can cover up to 90% of your pet's unexpected eligible veterinary expenses. Together, CareCredit and Pets Best can allow you to provide a lifetime of care for your four-legged family member. For more information, visit carecredit.com.